Look at a bulletin board or pick up a newspaper in any North Country town, and you'll see ads for healthcare fundraisers, spaghetti dinners, fish fries, raffles. A health emergency can put most any family in desperate financial territory. How communities rally to pay their neighbors' healthcare bills on today's story of the day.
Support for Story of the Day is provided by Renew Architecture and Design, designing camps, custom homes, and more throughout NCPR's listening region. Details at renewarchitecture.com.
Hey, I'm David Sommerstein. It's Tuesday, October 3rd. First up, a 9-year-old girl who went missing while camping at Moreau Lake State Park over the weekend was found physically unharmed yesterday. Police have a suspect in custody for an alleged abduction. Monica Sandreski has details.
Charlotte Senna was reported missing on Saturday evening. She had gone out for a bike ride at the campground in Saratoga County and never returned. State police and the FBI launched a massive search around Moreau Lake State Park and in the surrounding areas. Then early yesterday morning, police received a ransom note and matched a fingerprint to 47-year-old Craig Nelson Ross Jr. Speaking at the state police barracks in Latham last night, Governor Kathy Hochul said police found Ross, his mother, and Senna in his double-wide in Boston Spa.
After some resistance, the suspect was taken into custody, and immediately the little girl was found in a cabinet, cupboard. She was rescued.
Senna was transported to the hospital and appears to be physically unharmed. Hochul says she's overjoyed by the news. Police charged Ross with first-degree kidnapping this morning. Monica Sandreski, North Country Public Radio.
So in every town in the North Country, people hold healthcare fundraisers to pay the bills. For our series on healthcare in the North Country, Lucy Grindon went to one benefit in Jefferson County last month for a little girl's surgery and brings us this story.
Just inside the Evans Mills Fire Hall, Sandy Connolly is selling raffle tickets.
Hello, ladies. How are we doing today? Buying some raffle tickets for the baskets? Yes.
She and a few dozen other volunteers are raising money for a surgery for a little girl who lives here in Evans Mills. Connolly says she's helped run lots of healthcare benefits over the years.
They're a lot of work, but it takes a team, it takes a family to do it all.
She's helped raise money for her own family members, for neighbors, and for friends.
My girlfriend who had stage 4 ovarian cancer, we did a big one for her at the Black River Legion.
How many have you been a part of, would you say?
In my life? A couple dozen. Easy.
High healthcare bills cause major financial stress for families across the North Country. Many live paycheck to paycheck, and when big health expenses aren't covered by insurance, they often try to raise what they need by throwing fundraisers. Connolly works at the Kohl's in Watertown. Today's benefit is for the daughter of one of her co-workers.
My name's Olivia, and I'm 8 years old.
Olivia Gorman, who just celebrated her birthday. She had her first open heart surgery when she was not quite 2 years old. Now she needs another surgery because one of her arteries is blocking her airway. For her, this benefit is almost like a birthday party. Her grandma baked all kinds of cookies, a DJ is playing, and the room is filled with colorful decorations.
My mom and everyone else remembered I like the color pink, and I like how they put a little photo thing where you can take photos.
Olivia's friends from school are here. They're taking silly pictures together at the do-it-yourself photo booth. When I ask her how it works, she assumes that I want to take a photo, and she starts rummaging through the props.
Where is it?
What are you looking for?
The other clown. You could be a cowboy.
Oh, okay.
And you have a guitar.
Oh, thank you. Olivia needs to see a pediatric airway specialist in Cincinnati for testing and surgery, and her insurance won't pay for it.
Our insurance doesn't cover out-of-state coverage.
That's Olivia's mom, Angie Gorman. She says for most of Olivia's life, she's been on U.S. military health insurance. Her dad, Jeremy Gorman, was an Army musician for 14 years, deployed twice to Afghanistan and once to Korea. He still gets health care at the VA, but his family isn't covered by military insurance anymore. Instead, they have insurance with Fidelis through New York State. When Olivia had to go to a children's hospital in Pennsylvania for testing last year, her visit wasn't covered.
That appointment alone was almost $10,000.
So Angie had to go into medical debt.
I had opened a personal credit card through my bank, and that's what I used.
Olivia's doctors have tried to convince Fidelis to cover her out-of-state care, but they won't budge.
It frustrates me that they won't cover out-of-state, especially when they've been told she needs to be seen out-of-state, by numerous doctors. They've told the insurance company, she's seen everyone that she could see here in New York for her condition.
The Children's Hospital in Cincinnati is a 12-hour drive from Evans Mills. Olivia's parents will both take time away from work. Angie works 2 jobs. Besides working at Kohl's, she also runs the after-school program at a local elementary school. Jeremy works as a house painter. They'll stay at the Ronald McDonald House, but they'll still have to pay for gas, food, and everything else.
This first trip with testing and a procedure, I would say anywhere from $60,000 to maybe $80,000. The actual surgery, probably hundreds and, thousands of that, lot.
If her open heart surgery was $190,000, you can imagine how much this one's going to be.
When I ask how they're going to afford it, it's the first time I've seen Angie look overwhelmed.
For this trip, we're just, like I said, we're having this fundraiser, this benefit tonight. Hoping to raise whatever we can and then and everything will go towards the bills.
While she's playing over by the DJ booth, Olivia sees a friend across the room. She starts running towards them to say hi. Her dad, Jeremy, notices immediately, and he stops her. He says it's not safe for her to exert herself physically.
One of her airways isn't the right size. It's half the size it should be. So her body's expending so much energy to try to breathe, and it occasionally will cause her to be very, very physically exhausted. There's some times where she'll just pass out from being so tired, and when we try to wake her up after a couple hours, just like a usual nap, she won't wake up.
She can't run around like her 4 siblings, and she doesn't get to play outside at all if it's too hot or too cold, so she can't really make snowmen or have snowball fights.
And it's incredibly difficult to be able to tell her that because she cries a lot about it when it happens.
Olivia says it's hard for her.
For once, I just want to run fast, and for once, I just want to try to be normal.
She says she's anxious about her trip to the Children's Hospital in Cincinnati this month.
I feel nervous about, sometimes I think surgeries or doctor things won't work.
She also says she's never been to Ohio and she doesn't like needles, but she knows what the surgery could mean for her life.
That I can run more, I don't have to take inhalers and machines, and I don't have to stay behind on activities.
Olivia's family, friends, and neighbors are doing whatever they can to help her get the care she needs. Her old kindergarten teacher donated about 50 pounds of pasta. Her mom started a GoFundMe page. Her mom's manager at Kohl's reworked the store schedule so lots of coworkers could help set up. And 2 coworkers' husbands are serving spaghetti, meatballs, and red sauce into styrofoam containers. Kitty Young is one of Angie's coworkers at Kohl's. She brought an extra helium tank she had left over from a birthday party.
We're just making it a little more festive and blowing up balloons for the tables, for centerpieces, and her colors are pink and red, so we're just trying to make sure that we have everything look very festive and lighthearted.
Young was one of the main organizers of this fundraiser. They had their planning meetings and gathered supplies at her house. She'd never helped organize a healthcare benefit before, but she says she would have done anything for this family.
So, okay, I'm getting emotional. It's okay. Well, sorry. I knew I was going to do this today. What won my heart over with Olivia was Angie was having a birthday party for one of the kids one day, and I had my plate. Olivia walks over, and she whispers something to me. I couldn't tell what she was saying. And she whispered it again. I still didn't get it. And she said, "Can I take your plate for you?" So here's this little doll, so I will do anything for that family. They're just wonderful.
Ultimately, the fundraiser raised $6,394. That'll cover about 6 months of groceries for Olivia's family, but it's barely a dent in what her surgery will cost, so the fundraisers will have to continue. Lucy Grindon, North Country Public Radio, Evans Mills.
We have more news all the time on our website, ncpr.org. Music today by Caitlin Scholl of Lake Placid and Eddie Lawrence of Moira. I'm David Summerstein, North Country Public Radio.